Hi, I'm Jinghui Cheng from Polytechnique Montreal, and I'm presenting our work exploring the challenges and tool needs of patients when self-managing postoperative acute pain. This work is done with my former student Souleima Zghab, my collaborator Gabrielle Pagé from the University of Montreal, and our patient partners Mélanie Lussier and Sylvain Bédard. This work stems from the recognition of the importance of patient self-management of postoperative acute pain and the lack of technological support and research focus in this area. There are millions of individuals in many major countries who undergo surgery each year, and it is estimated that more than 80% of them experienced moderate to severe acute pain after the surgery and were prescribed opiate-based analgesia following surgeries. Self-management of acute pain, however, is more than taking the medications. It is a multifaceted process involving not only the management of analgesic intake, but also adopting non-pharmacologic strategies such as cooling and compression, breathing, meditation, and relaxation to control pain in the patient's daily life. This is particularly because pain is not only a sensory experience, it is also an emotional experience, as described by the International Association for the Study of Pain, an experience in which psychological factors play a big role. Poorly managed postoperative acute pain is associated with a broad range of negative consequences, including delayed recovery, impaired function, development of chronic pain, and prolonged use and reliance of pain medications. Previous literature has established that technologies may help make self-management of many health conditions, including pain, more effective, accessible, and affordable. However, the current exploration of technologies for pain management mostly focuses on chronic pain. Management of acute pain, however, has several distinctive characteristics that pose unique challenges in technology design and thus require attention from the HCI community. Acute pain often originates from rare life events, for example, a surgery. Patients are thus usually unfamiliar with those experiences, leading to a variety of emotions such as anxiety and stress as they navigate the new health condition and the uncertain experience of pain. Additionally, the design of technologies needs to consider the relatively short time frame of acute pain and the altered cognitive and emotional states patients are in as a result of postoperative recovery and medication intake. The success of digital tools that rely on their ability to motivate and engage patients, establishing trust while providing the needed support within a very short period of time. Because of these unique characteristics, it is crucial to investigate users' challenges in self-management of acute pain and their needs for these tools to help establish design opportunities. We approached this issue through an interview study with patients who recently experienced postoperative acute pain. The interview study was conducted between June 2021 and August 2022 with 14 participants from Quebec, Canada. The participants were recruited through flyers posted in hospitals and on social media. The age of the participants ranged from 19 to 77, with a mean of 45. On average, the participants completed the interview 20 weeks after their surgery. All interviews were conducted over Zoom. Each lasted approximately 60 minutes. During the interviews, we asked the participants questions about their experiences, challenges, needs, and strategies used in postoperative pain management. We also asked questions related to their general reviews on technology used for pain management, including the type of information they need and the essential features they wish to see in an ideal tool. Interviews were recorded and fully transcribed for an inductive thematic analysis conducted by the authors. It is worth noting how our positionality as researchers has shaped the way we collected and analyzed the data. The research team is composed of 2 members who are experienced in HCI research, 1 member who is a researcher and clinical health psychologist focusing on pain management, and 2 patients who have experienced first-hand postoperative pain. Each interview was conducted jointly with 2 authors, 1 HCI researcher and 1 patient author or the health researcher, to ensure that both technological and health-related aspects were sufficiently covered. The data analysis was led by the HCI researchers with input from the other authors to focus on implications towards technology design. Through the data analysis, we identified themes that are associated with several major aspects of self-management of post-operative acute pain. We summarize some of our main findings now. For more detailed information, please read our paper. Self-management of post-operative acute pain starts at the transition from hospital to home care, and this transition is a bumpy road for many of our participants. Participants often felt that the hospital leaves were rushed, which caused great frustrations and uncertainties. And because surgery is often a rare life event, sometimes following an accident like falling or car collision, participants mentioned that they needed assistance to quickly establish expectations, even before the surgery. About these, P9 discussed that this information is useful to help them to prepare for the interaction with the medical team. Even with the guidance and preparation, new unexpected health conditions may emerge after transitioning home. Participants indicate a need to have support to react to such unexpected situations and manage the stress and frustration associated with them. The challenges of self-management of post-operative pain are often associated with the uniqueness of the pain experience, as discussed by our participants. Because pain is a unique and subjective experience, participants find it difficult to assess the normalness of their pain experience. According to P1, for example, the supposedly comforting practice of sharing and discussing their experience may become a source of anxiety. The complex pain experience also made it difficult to assess pain in isolation using quantitative metrics. Our participants voiced concerns regarding the use of the typical 10-level rating scale to assess pain. The quote-unquote level of pain also evolves quickly over time. Participants explained that those pain episodes often came fast, and in severe cases, they simply forgot what to do when in pain. So our participants discussed the need to have tools that can help them detect such critical situations and redirect them to adequate help. Another important aspect discussed by our participants is managing the stress of a mixture of emotions of being overwhelmed, helpless, depressed, and anxious. Our participants discussed that their emotional state is frequently impacted by the intensity of their experience of pain. Moreover, negative emotions can result in a higher intensity of pain, making it a vicious circle. Caregivers and broader social networks both provided important support to our participants. The participants expressed gratitude to their caregivers, who usually played a crucial role in the participants' post-operative journeys. However, for many participants, although their caregivers had a strong desire to be of assistance, they are not equipped with sufficient knowledge and information about how to do it well. Similarly, regarding the broader social networks, participants indicated the desire to learn about the pain experience of other patients with similar health conditions, as discussed by P5 here. At the same time, they also worried about potential issues with experiencing sharing, such as negative messages and inaccurate information. Together, these aspects and themes painted a complex picture about the challenges and needs of patients when self-managing post-operative acute pain. Our results indicated three important factors that need to be incorporated in tools designed to support self-management of postoperative pain and acute pain in general. I'm going to present two of these factors here. First, rapid changes require both proactive and on-the-spot support. Different from many chronic health conditions, patients undergoing postoperative acute pain frequently encounter swift changes in their health. Echoing the literature, our work confirmed and emphasized the transitioning from hospital care to home care as a major obstacle for postoperative patients. More importantly, during the progression of pain after discharge, quick changes may also occur, which is a factor that is less discussed in the literature. Moments such as these are the ones in which participants require support most urgently. However, those are also the moments in which the participants are the most vulnerable. As a result, providing information or support only at those moments is usually counterproductive. At the same time, dumping a large amount of information to prepare the patients may also not be a good idea and can easily overwhelm the patients. Digital tools for post-operative pain management thus need to carefully consider the timing and the manner of information and support delivery. Second, self-management support should focus on individual situations in context. A recurring theme that emerged from our analysis is that postoperative acute pain is a personal experience that is unique to each individual. For example, our participants emphasized that their pain experience was often complex and should be evaluated from different dimensions. There's also a complex picture regarding social support due to the uniqueness of the patient's acute pain experience. Particularly, while patients value the support provided by their caregivers and peers, communicating and comparing their pain experiences usually created a source of anxiety. So, tools should provide highly personalized and dynamic support for the patients. This does not only concern the features related to pain assessment and management strategies, but also many other aspects, including social features, such as matching with users who had quote-unquote similar conditions. Overall, our study provided valuable knowledge to address the less investigated but highly needed problem of technology design for the self-management of acute pain. Our efforts can inform other studies focused on the design of supportive technologies for similar health conditions. Thank you so much for your attention. Please read our papers for details and contact us if you have any questions or comments.